Hello, hello, hello. It is 11 a.m. on the dot. We are coming in hot, coming in ready. We got some great information for you today, and we cannot wait for you all to join in this incredibly important conversation we are having today. Hello, everyone out there in Facebook and Twitter land. Welcome. It is Monday. Can you even believe it? It was a extremely busy Monday morning. My son is off for summer break, so he's home. My husband's off today. I was doing lots of things this morning, so it was kind of like a mad dash to get ready for this Lupus live chat, and I'm so thankful everything came together, and I'm ready with some great information. Welcome all. Let's see who's joining already today. Good morning, Carrie. Don't forget to share this on your personal Facebook page because we have a giveaway today. Yes, guys, we are doing a fun giveaway. I'm going to tell you about it in just a moment, but I want some people. Perfect, Carrie. Thank you so much to log in so that we can start going with this really great conversation today. Carrie, remind me, where are you joining from? You're on the East Coast, is that correct? I think, yes. But yeah, welcome everyone. So happy to have you, those that are starting to log in now, and those who will be watching this later and streaming this later. Whatever the case, we're happy you joined in today. Washington, oh my gosh, you're right above us. I keep forgetting that. That's right. You are right here in the Pacific Northwest. As people start to log in, don't forget to share this on your personal Facebook page. You're going to hear me saying that and write shared in the comments. Reason is today we are doing a really special giveaway. Today, anyone who shares this on your personal Facebook page will be entered to win this lovely candle. I don't know if you can see it right here. This lovely candle that is from my Lupus sister and friend, Nicole, who has a shop outside of Portland called Little Black Dog Vintage. And she has a vintage shop. She's open mainly on the weekends. They have so many adorable and unique items that is, just from antiques to just super cool treasures. And these candles that she has at her shop, they smell so good. I have one called Joy, and then I ordered another one. This is Clarity. Anyway, it's like 40 hours of burning time, and it smells so good. So this one has, I think, a little bit of a eucalyptus scent to it, which is great, kind of rejuvenate you. Anyway, we are giving this away today. So if you share this on your personal Facebook page and write shared in the comments, you will be entered at the end in our spin the wheel to win this great candle that is brought to you by Little Black Dog Vintage, owned by no other than our Lupus sister and friend, Nicole, outside of Portland. So here you go. Yay! So excited, Nicole. I've been holding on to this. Can't wait to give it away because I got my own candle. So, haha. Anyway, so yeah, that's happening. We are live and it is morning. Hello, Darian. It's Monday morning and I'm so happy to be with all of you today. It is June 12th, right? I can't even believe it. We're halfway through June. How is that even possible? I just feel like time is going by so quickly. And though May is over, our advocacy is not, right? Yes, lupus awareness and advocacy is something that we do 12 months out of the year. So the work goes on. In fact, this month for June, we are focusing on Men's Health Month. So this month we'll be featuring our male lupus advocates and talk about how lupus can affect men. June is also scleroderma month, as I mentioned last week. That scleroderma is a connective tissue disorder that's similar to lupus. In fact, I have a patient advocate who I connected with on LinkedIn who was working on a special blog. She has scleroderma, and she's going to write a special blog for us telling her story with living with scleroderma and what scleroderma is and how it affects her. And that will be out by the end of the month. So super excited for that as well. It's also PTSD Awareness Month. So we've already been posting people's personal stories that we just feel so honored that you trust us to share those, as well as the blog and certain infographics about medical post-traumatic stress disorder. Let's see, what else? June is Migraine and Headache Awareness Month. And we have a brand new blog that was vetted and medically reviewed by Dr. Don Thomas, who wrote the Lupus Encyclopedia. So check that out as well. That's on our website. It's on our social media. It has the perfect amount of information to be informative and not overwhelming for Migraine and Headache Awareness Month. And lastly, June is Antiphospholipid Antibody Syndrome, which is long for APS, which is how you usually hear it referred to. Awareness Month. Yeah. So APS is a disorder that can lead to strokes and heart attacks from severe clotting. And it affects an estimate of 1 in 2,000 people in the United States. An early diagnosis of APS and the condition can prevent these severe things from happening. And we're going to talk about the interplay of APS and lupus and pregnancy in lupus and cardiovascular health in APS and lupus and the signs and the symptoms and the treatments in just a moment. So you do not want to miss this. So if you're watching right now, guys, make sure you share this on your personal Facebook page so people have access to this information. But first, let me introduce myself. I've been rambling on here. My name is Kelly. Hi, everyone. If you're new to all the, I don't know, what is it, like 200 new followers we have in the last month? Hi, welcome. Hopefully you're getting connected to support and getting immersed in the resources we have on our website and our social media. And if I haven't had the pleasure of seeing you here, and maybe you're here for the first time, my name is Kelly, and I'm the creator and executive director of the Portland-based nonprofit More Than Lupus. Sorry, I didn't have time to shower today or do my hair, so this is what you get. And I'm owning it, okay? Because sometimes we only have so many spoons. Can I get an amen? Yes. So if you're joining for the first time, More Than Lupus is an inclusive community designed by lupus patients to connect and to grow and to inspire you throughout the peaks, which are the highs, and the valleys, which are the lows of your unique one-of-a-kind lupus journey. And let me tell you a little bit about myself. We call this More Than Lupus because we understand we are many parts. And I'll just tell you a little bit about myself so you can learn some of the many parts that make up me. I love music. I love dance. I love design. I love chocolate. I love a good book. I love a good conversation. I love hearing people's stories. I love a good podcast. And yes, I have happened to have lived with systemic lupus erythematosus and multiple lupus overlap conditions since the age of 11. Yeah, a long time. 32 years. Now I just gave away my age. So yes, and I am your facilitator today for this Facebook Live support chat, hang time, community gathering, support forum, whatever you want to call it. And before I dive into today's topic, I want to remind everyone that our More Than Lupus June in-person support group and Zoom support groups are meeting this Saturday, usually the third Saturday of the month. And that is June 17th. So in-person meets at Tabor Space at 10 a.m. in Southeast Portland. The address is on our website. The information is on our social media. And Zoom will be meeting online at 1 p.m. Pacific Standard Time that day as well. The Zoom is a great way, guys, if you don't live in the Portland metro area, that you can get connected to community. And it's so fun having people from all over the U.S. joining in, talking about their experiences. And we are just a huge community of people that really learn and grow and inspire each other. So please join us if you can for one of those. If you are on our email chain, you'll be getting the email with the Zoom link this week. And you see the updates for our infographics on our social media. If you're joining us in person, you'll see the address online and all of that. So hopefully one of those works out for you. We'd love to see you and join in some more intimate conversation. And if those two don't work out for you, and you just want something a little bit more casual, but a little bit more intimate than these Monday Facebook Live support chats, don't forget that we have a private Facebook group called More of More. And guys, I'm on there inquiring about things all the time. I'm asking, okay, what do you want to hear for the month of June or July? Do you want to hear more about this or more about that? Do you want to see more of this on the website or more of that on the website? And I post things that I don't usually post on our normal Facebook page because it's so saturated already. Hopefully saturated in a good way with good morsels and gems, but I don't want to just overwhelm you with information. So I do surveys and people post things from other organizations that are really helpful. They post questions in a more intimate, private setting. So it's More of More. And all you have to do is type that in the search bar and answer a few questions, guideline questions, and then you'll be in. So you're welcome to do that as well. Okay, guys, on to our topic today. First, I want to ask you, who out there watching right now has APS, Antiphospholipid Syndrome? Write in the comments, okay? Write in the comments because June is Antiphospholipid Syndrome Awareness Month. So today we're going to talk about what it is, how it affects the body, what's the interplay between APS and lupus and pregnancy, and how it can affect your lungs, how it can affect your heart, all of those things, okay? But I'm really interested to know who on here right now has APS. So please do two things. Write if you have APS, antiphospholipid syndrome, or also write if you shared this on your personal Facebook page, because let me remind you, we're doing a giveaway today. We're giving away this amazing candle from Nicole Lowry's shop, Lupus Warrior, and sister and friend of us here at Little Black Dog Vintage. So we're going to give this away at the end. So write shared and then also write if you have APS. So antiphospholipid syndrome, sometimes referred to as Hughes syndrome or ACL syndrome or anticardiolipin antibody syndrome. Those are names you might hear. APLS. It has a lot of names, but what is it? Now, people with lupus may develop antiphospholipid syndrome that can cause blood clots. This is something that affects the blood and other health problems. In fact, 30 to 50% of people who have systemic lupus will be positive for these particular antibodies. What is interesting about this? There's a whole historical interplay with APS. What is interesting is that the test they use, one of the tests that they use to diagnose antiphospholipid syndrome, I'm just going to use that instead of all the other names because that's what it's more broadly known as, APS or antiphospholipid syndrome. One of the tests that they use to diagnose it is the same test that they use to identify syphilis in the body. This is interesting because people who have had lupus for a long time, who indeed had and have antiphospholipid syndrome, were falsely diagnosed with syphilis and not treated appropriately for their lupus and their APS. Besides, I'm sure people who indeed had lupus and antiphospholipid syndrome feeling baffled and maybe even shamed because of this syphilis diagnosis, I cannot help, which is incorrect, by the way, I cannot help but think this false syphilis connection, and this, or I should say this positive syphilis test, but false syphilis diagnosis because they don't really have it, plays into the fabric of lupus patients being medically gaslighted and dismissed. I cannot help but to assume that there's something there with this constant question mark and dismissive attitude and flippant attitude that some medical professionals have had in the past about lupus patients. It was kind of like a bias placed on the people that are most affected with lupus because of testing positive, coincidentally, for syphilis, even though that's not what was going on. It just so happens, for whatever reason, the syphilis test and the antiphospholipid antibody test do the same thing. The same thing. So, sorry, that's a little tangent, but I just feel like there's something there. There's something there. And we're going to write a blog about this, and I'm going to pick Dr. Thomas's brain about that, and we'll get you some good information on that. So, antiphospholipid syndrome is categorized actually as a rare disease, and it really wasn't classified and made into a concrete diagnosis until the 1980s. So for those patients before that time, and even into the 1980s and even into the early 90s, who were diagnosed with lupus, if you had antiphospholipid syndrome, you had a high likelihood of having some pretty scary complications because you weren't diagnosed and treated promptly. Like I said, wasn't really even looked at until the 1980s. They had that weird syphilis test. Everyone was confused. No one knew what to do. And so people who had this, they were at real risk of having some severe complications from it. So what is it? Now, antiphospholipid syndrome is diagnosed because you test positive for antiphospholipid antibodies. And everyone makes antibodies, which are certain proteins that are in the blood that fight off illnesses and viruses and foreign invaders in the body, right? But if you have lupus, and how we know that our immune system works, you may also have antibodies that are in superdrive, that are overactive and attack healthy cells and tissues by mistake. You can't tell the good from the bad. That is what lupus does. Yay! Aren't we lucky? And some people with lupus make antibodies called antiphospholipid antibodies. Now, many people with antiphospholipid antibodies will not have any complications, but some people will have blood clots inside of their blood vessels, and because of that, they can have problems with pulmonary embolisms and strokes and pregnancy complications. Now, antiphospholipid syndrome is what you're diagnosed with when these antiphospholipid antibodies cause complications. Over time, about 50% of lupus patients who have antiphospholipid antibodies will develop blood clots. Let me just pause there. That's a big statistic. I don't mean to be Debbie Downer, but I want to be clear. It is important for us to understand, and understanding and knowing more, we can fear less because we are informed and we know what to look for in case certain symptoms bubble to the surface if you indeed test positive for antiphospholipid antibodies. So like I said, 50% of lupus patients who have APS antibodies will develop blood clots. You got 2 APS lupus patients in a room, one of them will get blood clots, okay? Which is why it's so important to talk about this and increase our health literacy about this topic. Now, so this blood clot issue doesn't just preclude to possible issues such as strokes, which are blocked blood flow to the brain that can cause brain cells to die, or heart attacks, which are blocked blood flow to the heart, which can cause the heart muscle to have complications, and pulmonary embolisms, which are blocked flow to the lungs. You probably all have heard these terms before, can cause lung tissue issues. But issues, as I mentioned, with pregnancy. People with antiphospholipid antibodies can have recurrent miscarriage due to this problem. And I just want to take a moment right now and pause. Because those of you who are watching this live and those who may be streaming this later, your heart may, and your stomach may have just sank, right? I just want to say, if you have suffered a miscarriage, or multiple due to blood complications from lupus or antiphospholipid syndrome, you are not alone. I have, and my heart breaks with you. I do not use the word suffer lightly. That is not a word flippantly thrown around here. This is one of the most heartbreaking parts of having lupus. The process as a woman of preparing your body, going through all the right things, preparing with your high-risk doctors, getting off all those dangerous medications that you've been told you can't be on when you're pregnant, preparing your partner for this journey, only to have your hopes lifted when you learn you're pregnant, then to lose your pregnancy. It is devastating. Devastating. And the physical and the emotional strain it puts on your body, not to mention the hormones and medications and on and off and this and that, are intense and extremely difficult. So I don't want to just be rattling off information for you today, and I also don't want to say something that's going to re-trigger your traumatic experience of losing a pregnancy, or 1, 2, 3, 4. I just want to say, we see you, we feel you, I've been there, and it sucks, and it hurts, and it is wrong. That on top of everything else that we have to go through, when you have that desire to start a family as a woman, and I know I don't mean to exclude the men in this conversation, because you're a part of this conversation, or whoever the partner is involved in the relationship, and you go through all of that, and then it's just taken. It feels like it's just taken. It is so hard. So I just wanted to pause and say that it is important to know. It is important to know if you are positive with APS antibodies. But I want to give you some hope here, okay? I want to give you some hope. I also had a successful pregnancy. I had preeclampsia at the end, okay? And that's expected with lupus and blood issues. But I also had a successful pregnancy. And for those of you watching who either have APS antibodies or know someone who does, not everyone with antiphospholipid antibodies will have pregnancy complications. But I just wanted to take a moment for those who are watching this now and streaming this later who have had, and acknowledge it, say it out loud, and to know that you are not alone. Okay? All right. Let me pull myself together here. Not everyone with APS antibodies has pregnancy complications. Some people do have pregnancy complications. As I mentioned, miscarriage, preeclampsia, which is a condition that develops in pregnant women involving high blood pressure, and then also the presence of protein in the urine. That's what happened to me. And how I was reading in the Lupus Encyclopedia today as I was preparing for this chat, if a woman is positive for APS antibodies, has one or more miscarriages, has preeclampsia or eclampsia with pregnancy, then she is said to have APLS, which is a form of antiphospholipid syndrome. So how do doctors diagnose this? Your doctor, if they suspect that you have lupus, they will test you for these particular antibodies. And they want to make sure, the reason they're testing is they want to make sure that your blood is clotting normally. There are several actually different blood tests that are used to detect antiphospholipids in the blood. Okay, here's some great information for you. Write it down. I can put this in the chat box in the comment section after we are done. The first, the anti-cardiolipid test. Second, the lupus anticoagulant test. Third, the beta-2 glycoprotein 1 antibody. Then they're going to do the false positive syphilis tests, which we don't know why. I'm going to find out more about that. I don't want to comment on something that I have very little information on. And the antiphospholipid test, antibody test, okay? Now, some of them, like the syphilis test and the antiphospholipid antibodies, oh my gosh, that's a mouthful. Sorry, I'm butchering that. Those two, they don't know a lot about the role with the blood clot formation. It's not well defined, but they test them anyway, and it all helps with this diagnosis. And if you are within childbearing age and before starting a family, it is important to have those blood tests done to determine if APS antibodies are present. And if they are, to be aware that, yes, there may be an increased risk of developing lupus fibrosis and pregnancy complications, but there are things that they're going to do. Your doctor will ask questions about your medical history to find out if you've had problems like this before, blood clots, different things like that, low platelets, miscarriages, other pregnancy complications. They're going to ask you all these questions and put the pieces together. All right. And like I said, if you want those tests, I can put them in the chat box. I know I'm giving a lot of technical information here, and hopefully it is helpful. Hi, Howard. I'm so glad you're watching today. And yes, these chats remain on our Facebook page. I can download them to YouTube so you can share them with people who do not have Facebook. But yes, they remain on the page. Anyone can go back and watch them. So what's the treatment for antiphospholipid syndrome? Now, if you have been diagnosed with antiphospholipid syndrome, either from a rheumatologist or a hematologist, or maybe your primary care suspects this may be something going on as well, and you had a blood clot that has been shown to be problematic, you will need to take medications to prevent blood clots. These are called blood thinning medications. The most commonly recommended medications for this are warfarin, which is sometimes gone by the brand name Coumadin pills, and heparin. So warfarin and heparin, if it ends in an "in", it's usually a blood thinning medication. And heparin is actually injections. And then they will regulate your blood levels to make sure they're not thinning you out too much. Okay, that's called your INR. Sometimes with pregnancy, you can't be taking these certain medications. So what they will do is they will give you low dose aspirin to prevent blood clots, which hopefully prevent miscarriages and pregnancy complications. It is incredible knowledge to know if you are positive for these antiphospholipid antibodies, because sometimes all it takes is taking a low dose of aspirin every day, and you can sidestep disastrous landmines. It's that simple sometimes. It really, truly is. That's why I want to show you some hope here. Okay. Now, there are limited studies that show that oral anticoagulant, which means anti-blood clot medications, are not as effective as warfarin in preventing clots. But there's more studies being done and more evidence that suggests that warfarin or heparin is just absolutely necessary to prevent blood clots. There are other medications that, as a lupus patient, you should be taking to make sure that you are setting yourself up for success. I just mentioned data that talked about with antiphospholipid syndrome doing a low dose of aspirin, also called baby aspirin. It can be very, very helpful. And then, of course, the lupus life insurance policy that kind of is a blanket of help over everything, and that is hydroxychloroquine. Or if you take the brand name, Plaquenil. And that is tremendously helpful from these overactive antibodies from spreading. So sometimes, as I mentioned, you can have these antiphospholipid antibodies present in your diagnostic testing, but never have a clot or a pregnancy complication. If that's the case, your doctor still may have you take a low dose of aspirin. Now, if your doctor hasn't done so and you're listening to this chat, may I just be very clear, I am not a doctor, and I'm not suggesting that you start any medication until you talk to your doctor and have an open and honest conversation, particularly if you're thinking of starting a family, okay? I'm just going off of the research from the professionals that I pulled for today's discussion. So your doctor may recommend low-dose aspirin, and obviously, if you're not taking hydroxychloroquine and you don't have any sort of reaction to it, they'll probably tell you to start taking hydroxychloroquine or maybe even adjust your dose. They may test your blood for the dosing to see and make sure that you're on the correct dose for your body. Now, there are certain other things that you can do to prevent blood clots without, you can let the doctors be the experts on the medications, but there are some healthy things that you can do on your own to help with blood clots. If you smoke, your chances of developing a blood clot raise significantly. So make a plan to quit. I know it's easier said than done, but it's so pivotal that you try, not just to help with blood clots, but also if you take hydroxychloroquine and you smoke, it literally cancels out the benefits of the medication. It's like you're not taking it at all. Another important thing is to stay at a healthy weight by eating a healthy diet and getting regular physical activity. And if you want information about exercise that's appropriate and necessary for lupus, check out our blog that we just posted a couple weeks ago. We have some great tips and tricks for you that are not overwhelming. Anyone can do it at any stage in their lupus journey to help you start to get moving, to get your blood flowing. I want to mention this. In my notes, I have a little note to tell you about birth control and hormone replacement therapy. We talked a little bit about this in our migraine blog about birth control and hormone replacement therapy can sometimes cause migraines. Well, sometimes it can also cause blood clots. So I want to be really open with your doctor about where you're at with your hormone replacement therapy or your birth control that you're currently taking, because these medications have been proven to increase the risk of blood clots. And if you have APS antibodies and you have been diagnosed with antiphospholipid syndrome and you take hormonal birth control, or hormonal replacement therapy. Sorry, my mouth is dry. My tongue's getting stuck. Your doctor may recommend that you stop or change these medications to prevent blood clots. But once again, don't stop or change anything until you have that open and honest conversation with your doctor. So now you're kind of going, oh my gosh, so now I need to be alert, right? What should I be looking for, Kelly? Like, what are the signs and symptoms of a blood clot? And if you have blood clots, you may notice some of these symptoms. Some people get blood clots in their arms and they get them in their legs. I've had some superficial blood clots as well in my wrists and in my around where I've had IVs that have gone badly. I've gotten big lumps and bumps of blood clots. Superficial blood clots are a lot less scary than deep vein blood clots. And with deep vein blood clots, you will most likely experience throbbing pain, cramping pain in your legs or your arms. You will feel swelling and you will see swelling. You will possibly feel redness and see redness. And from that redness, when you touch your skin, you will feel heat. And you know it's not from your arthritis, it's not in your knee, it's not in your joint, it's actually in the veins. If you have a blood clot move to your lungs, you may notice trouble breathing or shortness of breath, sharp chest pains that get worse when you breathe in, and you may even be coughing up blood. I know some of these things can overlap with some other lupus in the lung issues, including pleurisy, pleuritis, even pneumonia. But you know your body and you know something is new that you haven't felt before, and you know when something is not okay. And when you know, when that feeling comes over you like something's not okay, then, and you know that you have positive antiphospholipid antibodies, that's the time that you go and seek medical care. If you have any of those symptoms, get medical help right away and be sure to let your doctor know that you have antiphospholipid syndrome. But I also want, once again, I don't want to be Debbie Downer about all this. Just to be clear, blood clotting is not always a bad thing. Some people with lupus have low clotting levels, okay? The body's blood is usually in a liquid state. And when a person experiences an injury or has surgery, blood knows its job to thicken and clot. And that's a process called hemostasis. That's when your blood starts to thicken and clot. It's our survival mechanism, and it stops the spot that is bleeding. Okay, so it's not a bad, clots are not a bad thing. Our bodies are wired to do that. However, with lupus, sometimes this process is too active and a blood clot forms where it shouldn't be. Of course, here we are again being overachievers. So the result is a thrombus, which is a fancy schmancy word for a blood clot. And sometimes the clot detaches and can travel somewhere else in the body. And that's when it becomes an embolus. And then the blood clots can become dangerous because that's when they go to the lungs and you have, or your heart, and then you have the symptoms that I just explained. All this to say that if you have lupus or you suspect you have lupus, make sure that your doctor is doing the thorough blood work panel and checking for those antiphospholipid antibodies. The time is not to fear. The time is to know more so we can fear less and be prepared and be alert so that any of these things, when they start to bubble to the surface, you can already have a plan of action and you have already been proactive with taking care of yourself. That's the point with all of this today, okay? So during this month of Antiphospholipid Syndrome Awareness Month, I'd love you would share your stories with us. And we're going to have a blog coming out that's going to have all this information and more. So you can share it and read it, whether it's for yourself or somebody else that you know and care about who maybe suspects they have lupus or was recently diagnosed with lupus and is positive for antiphospholipid syndrome. antibodies. All right, that's all I want to say about that. And hopefully those of you who are joining now can go back to the beginning and watch all this information. Don't forget, guys, there's still time to share this on your personal Facebook page and write shared in the comments, and you'll have a chance to win this lovely candle, which smells like eucalyptus, smells really fresh. It's called Clarity, from our little shop that Nicole runs, our Lupus community member at Little Black Dog Vintage. All right, let's do our Lupus Facebook Live support chat quote of the week. Okay, here we go. It's from Glenn Schweitzer, and it says this: behind every chronic illness is just a person trying to find their way in the world. We want to find love, and we want to be loved, and we want to be happy just like you. We want to be successful and do things that matter. We're just dealing with unwanted limitation in our hero's journey. Oh, I love that. Behind every chronic illness is just a person trying to find their way in the world. We want to find love and to be loved and to be happy just like you. We want to be successful and do something that matters. We are just dealing with unwanted limitations in our hero's journey. Yes, yes. And for those of you who maybe are watching this, who had a temporary health scare, but moved on, it resolved, it went away, we're happy for you. But remember, that weight that you were able to put down, don't forget us in the chronic illness community. Don't forget what it's like for that temporary setback. For those of us who have illnesses that have no cure, these limitations that are placed, these heavy burdens that are placed, we do all the heavy lifting, and all we want is to be recognized as fully human, not broken, not subpar, not second-class citizens, and definitely not hindrances to society because of our chronic conditions or disabilities. We are on a hero's journey, my friends. And we have passions, and we have things that we love to do, and we have hopes, and we have dreams. And that is that. I was going to keep going there, but I'm not going to because I could go on forever. Okay. I should have said this disclaimer before I got into all the medical nitty-gritty. So I'm going to say it now so you can know that I said it. And no, here's our disclaimer. The More Than Lupus Facebook Lupus Life support chats are aimed to be a positive and open space where you can both give and receive support and encouragement from others. I am not a doctor. We are not doctors at More Than Lupus. We do have a medical advisor, Dr. Don Thomas. Thank you so much. But besides him, not a doctor. I'm not a doctor. Now, I cannot provide you with medical advice or even tell you that what has helped me in my 32 years of living with lupus will help you. All that we can do is give you information that you can hopefully in turn take back to your doctors and have an open and honest conversation about what is the best course of action for you in your unique one-of-a-kind lupus journey. This chat is also intended to provide support and encouragement to those who know someone living with lupus or are here to learn more, a friend, a family member, a loved one, a coworker, a neighbor. And if you don't fall into these two categories, if you're not a lupus patient or a lupus supporter, this is not the right chat for you. So please keep all comments positive, and any inappropriate material will be deleted. I see it, and you'll hear me say, refresh your page, and it will be gone. I've been doing so much talking, my mouth is so dry. We got 15 minutes, guys. I'm going to start at the top of the comments and work my way down. So now is the time to post any questions, any comments, any concerns, and I'm going to do my best to answer them or at least hope to open a discussion about them. And then at the end, we're going to do our spin the wheel for this candle. So if you shared this on your personal Facebook page, write shared in the comments so that we can enter you into the spin the wheel at the end of this session. Oh, wait, hold on. Oh, it smells so good. It's like eucalyptus and peppermint. Oh, that's great. Love it. Love it. Okay, guys, let's see who we have joining today. Yeah, make sure you post your comments, your questions. Maybe you know someone who's newly diagnosed and you have questions about how to support that person. Maybe you have a question about a symptom or a medication, want to know about what questions to ask at your next visit. Let us know. Ooh, I got to straighten my leg. Okay, good morning, Carrie. Good to see you there. So happy to have you. You shared. Awesome. Okay, good. And you are joining from Tacoma, Washington, which is so awesome. Okay, I'm going to pull up my little spin the wheel here. And let's see who else is going to share today. Okay, I got you in there, Carrie. Good morning, Darian. Darian, let me add you in to my spin the wheel. Yes, Howard, thank you for joining today. These live chats will be available on the More Than Lupus Facebook page. I can download this to YouTube, and then we can provide a link for you to share. Looks like his daughter was recently diagnosed with APS and lupus and Sjogren's, which is a lot of new information to soak up, and my bucket is overflowing. Thank you for sharing your knowledge. Absolutely, Howard. We are so happy to be here to assist you in any way that we can. If you go to morethanlupus.com, we have over 100 blogs there. Everything from things like we're talking about today, lupus symptoms and diagnostic things, to lifestyle, to personal testimonies, all of it to support our bodies holistically with lupus. We also have some great symposiums, and please check out our YouTube page. We have so many things that are posted there as well for your daughter. Love to see your daughter here sometime when she feels comfortable with doing so. And feel free to email us, and we'd be happy to answer any additional questions to help support you and your daughter during this time. Hello, Mom. My mom's here. So happy to have you here. Yay! Okay, hold on. Darian says, I had one test for it when I was first diagnosed, and it was negative, but I have had several miscarriages, preeclampsia, and a stroke. Does it take more than one test to diagnose it? I'm not sure which one they gave me. That is an excellent question, Darian. And as I mentioned, I'm not an expert. So I'm going to look into that and then get back to you about it, because I believe it is actually best to have all the tests done, because I have heard of this before. So let me reach out to my expert and do a little digging on that, because I do believe you should have all the tests so that you get a better reading about where you are in your levels. Because, as Dr. Thomas says in his book, if you have several miscarriages, preeclampsia, and any other issues, most likely you do have APS. We have Lupus Warrior Princess here. Good morning, Shannon. Good to see you here. How are you doing? How are you feeling today? So happy to have you. And then Carrie is here, and she says, good morning to you, Lupus Warrior Princess. Gosh, was that it? Did I get through all of that? Wonderful. Wonderful, guys. Yeah, I just want to remind you to make sure that you share this chat on your personal Facebook page and write shared in the comments. That way, in the next couple minutes, we'll do our drawing and spin the wheel, and someone will win the candle that we're giving away today. I also want to remind you that we have 2 support groups on Saturday. One is in person at Tabor Space in Southeast Portland, and that's meeting at 10 a.m. I will be there. And so will our co-facilitator, Anita, and hopefully a lot of people will be joining us for that. And then we have at 1 p.m. our Zoom support group. So that is open to anyone who wants to come and connect with people. There's people who join us from the East Coast and from Texas and Chicago. We have all sorts of people logging in the More Than Lupus community, which is so great to connect with them. Another thing I want to remind you of, we have our brand new migraine blog that is up on our website. And then we have our exercise blog that's new up on our website as well. And we are working on our antiphospholipid blog. That's the next blog that I'm going to get out to you. Also, oops, hold on here. I want to get the date correct because I am doing another virtual symposium on June 27th. And guess what day that is? That is National Microbiome Day. And so I'm going to put together a virtual event talking all about your microbiome. And your microbiome is on your gut and on your skin. And it is your largest immune organ. Did you know that? Yeah. You think the blood. No, actually it's your microbiome. And so when your microbiome in your gut is distorted from disease, medications, unhealthy habits, it can actually rev up your immune system in a not so good way with us with lupus. And so we're going to talk about that. We're going to talk about the mysteries of the microbiome on National Microbiome Day, and that's June 27th. And I cannot wait to delve into this because there's so much information there, and it's so important to be aware of what your microbiome is, how can you help it, how are you hurting it, and how it affects your health, specifically in regards to lupus. Yes. So that's pretty cool. All right, anyone else sharing this chat? Anyone? Before I do the little spin the wheel? You guys are so quiet today. Oh my goodness. Okay, so let's find my spin the wheel. Here it is. Let's do what's that? Okay, got you in there, Shannon. All right, I think I got everybody. Wonderful. Okay, let's do our spin the wheel. What do you think, guys? Yeah? Okay, I'm super excited about this. Here we go. Here's our little drawing, and oh, Carrie. Oh my gosh, Carrie. How is it that you win everything? Congratulations, Carrie. Your first win of the month. Yes. There you go. You get the candle. This is a great candle from Little Black Dog Vintage, which is our friend Nicole Lupus. Spin again? Are you sure? Are you sure, Carrie? Okay. Up to you. Okay. She's asking to spin again. And you just won again. Oh my gosh. Okay. This is hilarious. If it goes on you for the oh, Darian. Okay, thank you. Can you see that? Sorry, there it is. Darian. Woohoo! All right, guys. Well, thank you, Carrie, for being so gracious and letting somebody else have a chance to win. You've been on such a lucky streak. Oh, that's so great. Oh, thank you. That's great. Very kind of you, Carrie. So, guys, I guess, it seems like we got through everything, all the information. I just want to say thank you so much for listening to that. Our goal is to always see a need and fill the need, and, to not be empty information out there, but to really, truly strive to increase health literacy in the stuff we put out as a patient-driven, patient-centered organization. So thank you guys so much for being along the ride with us. And don't forget to share this chat. You can still share this chat, and also to take a look at the blogs that came out, and make sure that if you don't get our emails and you want to join our support group on Saturday, to private message us, email us, and let us know, and we'll provide you with the link to join the Zoom. All right, guys, I'm gonna log off 5 minutes early here. My family's downstairs. I'm gonna go say hi. So thank you guys so much for this time, and I hope it was informative to you, and have a great rest of your Monday. All right, take care. Bye-bye. Yes, I will, Shannon. Sorry. I just saw your comment. I will send you the information for the 27. Perfect. Bye.